Hi everyone, thank you for joining me on Facebook Live today on this snowy day here in Gwent. We're here on International Women's Day to sit down and have a chat with some of our clinical colleagues about women's health. We've had lots and lots of questions sent in, so thank you very, very much for that. So we're joined by Rhiannon, Gail and Nikki. Firstly, would you all like to introduce yourselves and tell us a little bit about you all?
Yeah, my name is Rhiannon. I'm the clinical lead physio for pelvic health. So I treat a range of conditions in physiotherapy, from urinary incontinence to prolapse to bowel problems, postnatally and antenatally.
And I'm Gail. I'm one of the gynae oncology nurses. So I pick up patients who are diagnosed with any gynae cancers. So I see them through from diagnosis through to treatment, and then after. And I'm just there to support and sort of make sure that their journey is as quick as possible.
I'm Nikki, I'm a nurse consultant in menopause, so I generally see women who have more complex conditions and sort of intertwined with their menopause, but also provide a lot of support to primary care as well.
Fab, thank you. Well, thank you all for coming, and happy International Women's Day, everyone. So, we'll start with some of the questions. And I know, Nikki, you've got to slip off because Nikki's got a clinic, so we're going to get a lot of the menopause questions out straight away, and we've had a lot. So, so I'm going to get cracking first. So, the first question is, how can I check if I'm perimenopausal?
So the term perimenopause means that you're probably getting some symptoms of menopause but still getting periods. So that's generally it, really. Lots of women think that maybe a blood test might be helpful, but generally blood tests are inaccurate and they're not very helpful. So if you're having some symptoms, or if your periods are starting to space out, maybe becoming a little bit more regular, a little bit heavier for some women as well, generally that's all we need really to diagnose perimenopause. Quite straightforward.
Okay, fab. We've had a lot of questions about kind of preparing for menopause. Lots of people taking an interest in their diet and their exercise, but they want to know if there's anything in particular that they should add into their diet, or whether they should take any supplements and prepare for the menopause.
Yeah, and it's really good that there's some questions about preparing for menopause, because lots of women don't, and then it's a bit of a shock when they get there. So yeah, it's great that people are asking these questions. So generally, there's nothing special to the diet and what you eat. You just need a healthy diet. You might have heard the term Mediterranean diet or rainbow diet, making sure you're eating lots of veggies, lots of different colour veggies, getting all your good vitamins and minerals, not eating too much sort of over-processed food, try and sort of cook from scratch where you can. Some women might need to take supplements, so if you don't eat a lot of dairy, you're not getting a lot of calcium in your diet, that might be something to consider with some vitamin D. What else? Protein, making sure you're getting some protein in your diet, because that's really good for helping to maintain your muscle mass. If you're a vegetarian, sometimes it's a little bit more tricky because things like chicken and beef have got lots of protein. So have a look in your supermarket, look for things that have got protein, protein pots, protein shakes, that kind of thing. Not too much salt, that can affect your blood pressure. Make sure that you're getting some activity. So sometimes people get a bit afraid when you say exercise and think, oh gosh, what am I going to be doing? Just be active. Try and get 7,000 to 10,000 steps in every day. You know, a bit of gardening, a bit of housework, anything like that is good activity levels. And generally just try and keep your weight down if you can as well, because women who are overweight tend to get more symptoms of menopause, so more flushes, more sweats. And also exercise and activity can help with mood. So again, lots of women get mood changes at menopause, maybe feeling a bit low, a bit anxious, a bit irritable, and exercise can help with that as well. So weight bearing, things like yoga, anything that gets you a bit out of puff as well is good for your cardiovascular system.
That's great. You mentioned vitamin D there. Somebody has asked whether you can take vitamin D alongside HRT.
Yeah, absolutely, you can take them together. Yeah,
that's great. So on to HRT, we've had a lot of questions about HRT. So someone has said that they're nervous to take HRT and feel, because they felt like they could manage symptoms, but it's getting a lot harder to. Is HRT the only option?
So HRT is not the only option. So look at lifestyle things first, like I've already said, your exercise, your diet, etc. But it might get to the point where you feel like you've done everything you can, but you're still struggling with your symptoms, and you might want to think about what you can take to prescribe it. So HRT is the gold standard treatment, and that's recommended in all our national guidelines that you should be offered HRT as a first line. However, not all women can take HRT, most can. And some women don't want to take HRT, they prefer to avoid hormones. So there are a few types of medication like antidepressants that can be helpful. They can help to reduce flushes, they can help to reduce sweats, can help with a few other symptoms, but they are not the gold standard. So have a think about why you might want to avoid HRT. Is it that you might be worried about breast cancer, for example, when the risk of breast cancer with HRT is actually quite low, and the benefits of HRT will outweigh the risk. Think about symptom control, think about quality of life. So there are other options, but HRT is your best option.
Fab, that's great. So someone else contacted us and said that they had been told that they should only take HRT for 2 years, but she's heard of other people taking it for longer. Why is that?
So generally, I mean, it will depend on your medical history, etc. But for most women, you can take HRT for as long as you want to. So there's no set length of time, for example, 5 years or 2 years. There's no upper age limit. And again, this is backed up by the NICE guidelines on menopause. And all women are individual. You need to treat the individual woman and treat the symptoms. Average is about 4 or 5 years for taking HRT, but there is definitely no set length of time for taking it. And I don't know where 2 years might have come from, but there might be something in the medical history that, most women can take it for as long as they need to.
Okay. And then another person has said, is taking HRT just prolonging the inevitable symptoms of
Yeah, and
menopause?
lots of women ask about that, and I think for some women it does put them off, because they think, well, when I stop my HRT, I'm just going to get all the symptoms anyway, so why bother? But that's not the case. So HRT will manage the symptoms while you're having them, and at some point those symptoms will go, and you might be that you're taking the HRT maybe for slightly longer than you need to because your symptoms have gone, but at some point when you decide to come off the HRT, your symptoms shouldn't come back. So like I said, about 4 or 5 years is about the average for taking it, but it definitely doesn't just prolong it or postpone anything, it just eases you through that transition with those symptoms.
Fab. Somebody has asked if they can take HRT and they went through the menopause over 10 years ago.
So generally we call that 10 years the window of opportunity, so we'd like to start HRT within that 10 years if we can, and the reason for that is as well as managing symptoms, you get a lot of benefits for your bones and you get a lot of benefits for your cardiovascular system. Once you're over that 10 years, you don't tend to get the benefit for your heart. You might get a bit of bone benefit, but you will get symptom benefit. If you are struggling with symptoms, you will get that benefit from HRT, but you probably need a bit of a prolonged chat with your GP about it. You might even need to be referred into our clinic depending on your age, etc. So it's not a definite no, but we might want to discuss it in a little bit more detail.
Okay. And somebody else has asked if there are any plans that could improve access to HRT.
So there's lots of issues in terms of access to GPs to start with, and then when you get to your GPs, lots of HRTs are unavailable. There's lots of stock issues, they come in and out of stock. So all of the sort of stock issues are being managed at a government level, UK wide. I think a lot of it is just education, working with GPs, working with primary care, and just trying to get the message out there. I think that's what's really good with people like Davina McCall. They've got the documentaries, people are not afraid to talk about menopause anymore. And even now, sort of 5 years on from, 5 years ago, people really struggled to get HRT, people weren't talking about it, so I think it is getting better all the time, definitely.
Okay, that's great. Somebody has said that when they attend the GP to discuss hormonal issues, often they just assume that they're depressed.
Yes.
Why is that?
I think sometimes, obviously a lot of women get low mood with menopause, they get things like anxiety, and it could well be that that's just related to menopause. It could be that they've got depression or anxiety and menopause, and it's trying to unpick it really. So they do need a thorough assessment. Is it the mental health? Is it menopause? Is it both? But generally it's worth having a try with HRT, because in 3 months' time, has their mood improved? Has their anxiety improved? So it's for the GP really to consider what is going on here and what's the best form of treatment. Unfortunately, some women are offered antidepressants as first line when they probably should have been offered HRT, but it's difficult for me to say unless you've actually got that person in front of you. Yeah.
Okay, and somebody has asked whether they should be taking a supplement as they get older to assure bone health.
So yeah, I think the main thing that you can do for bone health is exercise, be active, making sure you're doing your bone strengthening, things like walking, things like yoga can be really good for maintaining bone strength, but a calcium and vitamin D can help to maintain bone health as well, definitely.
That's great. We've got a few questions about periods.
Yes.
So we'll go on to that next. So first one, my daughter is 15 and hasn't started her periods yet. Should I be worried?
So I would say, no, don't worry. Generally, we would expect most girls to start their periods by age 15. So I would definitely take her along to the GP and they can start some investigations. There might be some blood tests, things like that. But we would generally expect periods to have started. But, you know, don't worry. It could be, you know, a straightforward reason for it. So just take her along and don't stress about it too much.
And someone else said, when is too much period pain too much? I feel like because I'm a woman, I just have to deal with it.
Yeah, and we've sort of spoken about this beforehand, really. And, you know, if it's impacting on your quality of life or your ability to even do things, you know, are you able to get your kids up to school and get them in the morning? Are you all right to get to work? If it's impacting on anything like that at all, then yeah, it is too much. And you certainly don't have to put up with it. There's lots and lots of things that can be done to manage bleeding and manage pain. So please go and see your GP and you know, speak to them. It might be that they want to do investigations. They might want to refer you to gynecology, but please don't put up with it because there's lots that can be done to manage periods.
And even GPs vary. I mean, some have had a lot of gynae experience,
Yes.
some haven't.
Yeah.
So if you're finding one that's not listening to you, just see if you can talk to a different one.
Yeah.
That's great. It sounds like this next person, it really is impacting their life. She says, I have very painful periods. It brings on nausea and I pass out most months. My GP has prescribed anti-sickness tablets, but these seem to just put me off eating and the sickness and pain is getting worse. I am bedbound most months on the first day of my period. What can I do?
And I think as well, the anti-sickness tablets are just sort of masking the nausea. They're not getting to the root of the problem. It is finding out what is causing the pain and can we manage that. You know, it's not normal to be passing out and experiencing pain like that. So yeah, please go and see your GP. And if if it's one you've seen before that's not very helpful, maybe see a different GP in the practice. And it's hard sometimes when you feel quite vulnerable and you know, but it's just trying to push for yourself and being your own advocate and saying, this is not normal, I would like you to do something to help me.
Yeah, that's great, thank you. So we've had a few different questions about different syndromes, and I know we haven't got Jo Kit here, who is our endometriosis nurse. However, we've had some questions about polycystic ovary syndrome and endometriosis. So I just thought I'd ask them to the panel and see if you can direct us. So we've got one here. I am overweight and I cannot lose weight whatever I do. I suffer with anger and aggression. I have just been diagnosed with polycystic ovary syndrome. What can I do to improve my life?
So polycystic ovary syndrome is a hormonal imbalance, and it gives lots of different symptoms, and they being some of the symptoms. Unfortunately, if you're overweight, it can make your polycystic ovary syndrome worse. So it's really useful if you can lose weight. So weight-wise, if you've tried on your own, you can always self-refer to the adult weight management team, and they can help out. And then if you've only just been diagnosed, are you on treatment? They just diagnosed you and then you kind of left. If so, then you need to speak to the GP and get referred, and we can look at giving some treatment for the polycystic ovaries.
That's great, thank you. So somebody else has asked if a coil will affect my endometriosis.
So that depends on the type of coil, because generally women with endometriosis have got heavy, painful periods. So something like a copper coil will probably make your periods heavier and increase the pain. Whereas something like a marina coil, which has got hormones in, generally is a treatment for endometriosis. It works really well for reducing bleeding and therefore reducing pain, and it's also a contraception at the same time. So if you're thinking of a marina coil, then I would definitely recommend that because it can help to reduce the symptoms of endo.
That's great. We've got another lady here who's 25 and has endo. She's had the laser surgery to remove scar tissue. How long could she expect her body to remain clear of more scar tissue?
It's a difficult one because it's very individual, so it's unpredictable, to be fair. We just have to go on symptoms really. So if your symptoms start returning, then we need to see you again and look. But it's very individual. You can't really predict it, unfortunately.
This particular lady also has polycystic ovary syndrome. Are they often linked, or do they affect each other?
Sometimes there can be a bit of a correlation. It's just, again, it's very individual, so it's really hard to say kind of like from that aspect of things. But in terms of kind of like scar tissue and things like that, things like yoga, good breathing and meditation, exercise again is really important for kind of like maintaining just kind of like that tissue health, because what we want to make sure is that that scar tissue's been removed, that we're continuing to move that area so it doesn't get stuck, you know, and we don't encourage kind of like that scar tissue again. So yoga is really, really good for kind of like post-surgery kind of like breathing techniques and movement as well.
Okay, fab. And somebody else has asked, should I change my contraception? I've taken the pill for 6 years, but I'm bleeding in between periods. Doctor said to change it or come off it, but I don't want to.
So I would say that I would go along to one of our contraception and sexual health clinics. So the staff there are the experts in contraception. It might be that you need a change in your contraception. It might be that you need some investigations as well, because it's not normal to get bleeding in between periods or bleeding throughout the month. So they can help to find you the optimal contraception. So whatever works best for you, what will fit into your lifestyle, but also they can do the appropriate investigations as well. I saw the signposting, we can pop something up on the page, can't we? Because we've got a triage number that you can call, and then you get an appointment generally within 2 days. So I would recommend coming through to a specialist contraceptive clinic.
That's great. Now I'm going to let you go because I don't want you to be late for your
Thank
clinic.
you.
So we'll let Nikki go
Thank
off
you very
and
much.
see her patients. And thank you. And we'll carry on our chat. And as Nikki said, if there's anything, we can put links into the post to make sure that everything's signposted for you. So we've got a few more questions, ladies. You're not let off the hook yet. We've got quite a lot of questions here about pelvic health. So this lady, I had a baby 5 years ago. I was referred to physio after. However, I have recently started to have little leaks again. Is that normal?
No, it's not normal. So lots of people in lots of comments that we have is that, I've had a baby or I'm getting older, so a little bit of leaking is kind of like acceptable and normal. We want to say that that's not the case. So even if you've been to kind of like physio beforehand, there's no harm in coming back and seeing us again. Making sure that you've been back on top of your pelvic floor exercises and you're confident with your technique as well. Sometimes as we get older and as babies and children get older as well, the demands on our life change, so maybe we just need to be able to function a little bit more. So if it's still happening and you're back up doing your pelvic floor exercises as you were previously, and you're still not feeling as though it's quite doing what it should be doing, your symptoms aren't resolving, then by all means come back and get another referral to physio. We're more than happy to see you again. Sometimes just by tweaking your technique again, we can make things a little bit better.
That's great. You mentioned pelvic floor exercises there. That's something that all women should be doing.
Yes.
So is there a particular amount of time a day or anything like that that people should?
Ideally, what we tend to say is initially when you've got symptoms, you should be doing them about 3 times a day. Okay, so we're not talking a great deal of time. And people go, I haven't got time to do pelvic floor exercises. When you've got good technique and you're nice and strong, you should be able to do a 10-second hold and be able to repeat that 10 times. And then follow that by 10 quick ones. Even if we're relaxing in between times, we're probably talking a total of 3 minutes at a time. Okay, so the time it takes to boil a kettle, and we're looking at doing that 3 times a day. Okay, once you're symptom free, then it's a really good idea just to keep on top of doing your pelvic floor exercises at least once a day. The other really important times to do your pelvic floor exercises is before you're lifting, before you do anything that makes you a little bit more vulnerable, puts a little bit more pressure down on top of your pelvic floor, and squeeze up and hold and support everything. You're going to reduce that risk of anything getting any worse later on down the line. Okay. In terms of doing your pelvic floor exercises, I know we'll put up the link to our pelvic health physio website. There's lots of information up there later, but basically what you're looking at doing is squeezing as though you're trying to stop yourself from passing wind, and then adding on as though you're trying to stop yourself from passing water, and that's your basic pelvic floor exercise. If you're moving whilst you're doing it, you're probably doing it a bit wrong, so we don't want to see any up and down, facials, I've seen lots of eyebrows, lots of wonderful facial expressions as I've been treating patients, but generally you should be able to sit there as I am now, just squeezing and holding and letting go. So no one should be know that you're doing them if you're doing them properly.
Fab, thank you very much. Do your pelvic floor exercises. What is a prolapse and how do I know when I should speak to my doctor?
So there's 3 different types of prolapse. So you can have a prolapse of your anterior vaginal wall, so sometimes known as a cystocele or a bladder prolapse. You can have a uterine prolapse, that's where your uterus is coming down. Or you can have a prolapse of your back vaginal wall or a rectocele, or sometimes that's referred to a bit of a bowel prolapse. Symptoms that we mainly hear are vaginal heaviness, discomfort, can sometimes be okay in the morning but gets worse as the day kind of like goes on. Okay, so again, the first line of treatment for prolapse is pelvic floor exercises. The better and the stronger we can get those muscles, the easier that is then, and we can prolong any kind of like treatment going on, or any more invasive treatment going on. Making sure that you're avoiding constipation as well, really important from a prolapse kind of like perspective. And when should you seek treatment? Is if it's bothersome, okay? But the earlier you get referral to physio or start doing pelvic floor exercises, then the easier that is to kind of like manage and stop it from getting worse as time goes on. But if it's bothersome, if it's causing you problems, then definitely go and speak to your GP about that.
Fab. And so if anybody has got any concerns and they feel like they need a referral to physio, they go to their GP to get that referral?
Yeah, they can do that.
That's great. This lady's pregnant and she's suffering with a lot of pelvic pain during pregnancy. What can I do to ease symptoms?
So, making sure that you're moving and you're not staying kind of like completely still, okay? Our body loves movement. It's how we're designed, it's how we like to be. What tends to happen during pregnancy is that we're usually quite active. We get pregnant, we stop doing everything because we're afraid of moving. What then happens is we end up getting quite stiff, kind of like in the front of our pelvis and in our backs as well. So we tend to kind of like alter how we're changing, how we're moving and holding our bodies. Also, that changes as the pregnancy progresses as well. So how you are, kind of like how you're holding your body at 20 weeks is going to be completely different to how you're holding your body at 30 weeks. So lots of kind of like nice pelvic movement. So just a nice pelvic tilt. Okay, you can just loosen things off. It might feel a bit uncomfortable to start off with, but what you'll probably find is that if you do it a couple of times, it starts to feel a little bit easier. Getting out and exercising, whether that's in water or just kind of like getting out and walking, doing what you feel is kind of like comfortable. If you're doing all those bits and pieces and it's not really helping, then by all means get a referral to physio. We can guide you a little bit more. On our webpage, we've got an antenatal section on there that's dedicated to antenatal pelvic health, and on there is a section on pelvic girdle pain. There's videos and advice on there as well, so by all means please go and look at that, and if that's not helping, then there's a self-referral there for pelvic girdle pain that you can fill in and send in to us in physio.
That's fab. Now this lady doesn't say how long ago she had a baby, and I've had children, so it does make a difference. Since having our child myself, my husband and I are unable to have sexual intercourse. Do we just have to live with it?
No, please no. So what I would say is, first off, go and see your GP just to make sure that there isn't any other kind of like undue cause or anything like that as to why that may be happening. But if you've had kind of like any tears, or you've had an episiotomy during kind of like delivery, or there's been any kind of like trauma from kind of like delivery as well, then sometimes your pelvic floor muscle can react in a way and can almost be kind of like overactive. We get scar tissue as well on those scars as well, which can sometimes be really sensitive, and that doesn't necessarily settle down. So whereas if you had like a scar on your arm, you'd go, oh yeah, and then you start fiddling with it and you make sure that you're massaging and you're touching it and you're kind of like loosening it off all the time. Unfortunately, if we get scars on our vulva or kind of like internally, kind of like vaginally, it's not somewhere that we touch or kind of like try to desensitize that scar. So sometimes it's just a case of coming to see us in physio, and we can help with kind of like any techniques with that from that point of view. We have got a section on our postnatal maternity page, on our physio page, about pain with intercourse and returning to intercourse postnatally as well. So there's some information on there as well. But please don't live with it. It's not normal. Please go and see your GP, and if it's warranted, a referral to maybe kind of like potentially gynae or to physio, then please go and seek that help.
That's great. And you mentioned scar tissue there, and somebody has asked, when should scars from childbirth stop hurting?
They can take a little bit of time. Sometimes they don't necessarily kind of like heal in the same kind of way as what a normal kind of like scar would do, kind of like on your arm or on your leg, and that's mainly because we don't kind of like touch it. If it hasn't settled at all, kind of like within kind of like 6 months to a year postnatally, then I definitely would go and see your GP. It may be that again you need to go down the route of going to see gynae, or it may be that you need to come down and see kind of like physio, because if that pelvic floor muscle is pulling on that scar, then that can continue to make that scar painful then.
That's great.
Especially if it's from a tear rather than so rather than a controlled cut and it's torn, then sometimes you might have to refashion it or
Yeah.
so,
Okay.
yeah.
Right, so we've had a lady here who's got a tilted cervix, and when she had a smear test she had to have it under general anaesthetic. Will this be the case for every smear test that she has?
It shouldn't. I mean, a lot of women with tilted cervix we can do in clinic. You can't sometimes do it in the GP surgery because they've got flat couches. In the gynae clinics we've got stirrups and we can put them in a different position, which helps, and they tilt and things. So it may be that we can do it in a clinic, but if it's for other reasons like pain and discomfort and she just finds it too uncomfortable for us to do it in clinic, then unfortunately it might be the case that we have to do that. But it's worth trying clinics again, because we've got different size speculums, we've got lots of different things that we can use. So I would, on the next smear, if the GP can't do it, then at least try the clinic again.
Okay.
We can kind of go from there.
That's great, thank you very much. Now, somebody was asking, what signs and symptoms should they look out for to be worried about any form of particular female cancers?
So there's a few female cancers. So if we work from the bottom up, so we've got vulval cancer, which is the cancer of the skin, sort of on your labia and at the bottom. So that's sort of dryness and itching. Unfortunately, we get that a little bit as we get older anyway, because you get skin changes as you get older. So it's looking out for any sort of symptoms that are abnormal for you. Lots of women don't look at themselves, unfortunately. So it's just knowing what's normal for you, and just, you can examine yourself there as much as you can examine your breasts. So, when you come out of the shower and just maybe having a look at the mirror or just having a little feel, and then if you feel any lumps or anything that are abnormal for you, maybe get those checked out, but especially if they're itchy, if you get any bleeding with them, if there's any ulceration or anything, so that definitely needs to be checked out by the GP. It could be a lot of benign conditions, but obviously we need to find out. And then we can work our way up. So you can get primary vaginal cancers, a lot of those, again, lumps and ulceration, but they will give bleeding quite quickly. So if you have any abnormal bleeding, so as Nick was saying, bleeding in between periods and things in those that are still having periods is not always normal. There are lots of reasons for it, so it's always best to get that checked out. And then especially if you're postmenopausal, so you've stopped your periods, if there's any bleeding at all, that definitely needs to be checked out. And again, it could be lots of different reasons, but it definitely needs to be checked out. Up to the cervix, so if you go for your smears, there's very small chance that you're going to get cervical cancer because we're keeping an eye on it and checking it. So I would say please go for your cervical smears, definitely. But again, so there's post-coital bleeding, so any bleeding after sexual intercourse or anything, or abnormal bleeding again in between periods, or if you've finished your periods and you're menopausal, any abnormal bleeding, get that checked out. Then we go up to the actual womb itself, so you could get endometrial cancer, so that's cancer of the lining of the womb. They give usually very early symptoms with bleeding again, which is easily picked up in postmenopausal ladies, so any spotting or anything, you need to definitely go and see your GP. Bit more difficult in people who are having periods, but changing in periods, so knowing your periods and knowing what's right for you. If you find any significant change, then I would definitely go to the GP and just see, just check it out. Again, it could be hormonal, it could be lots of different reasons, but it's always good to get that checked out. And then up to the ovaries, unfortunately, ovarian cancer is quite silent, so it doesn't give a lot of symptoms until it's quite an advanced stage. So if you notice any stomach swelling or bloating, any weight loss, obviously, any change in appetite, a lot of the times it gives you heartburn quite early on, but again, it could just be normal heartburn. So it gives very vague symptoms. So again, it's knowing your own body. So if something doesn't feel right and you're thinking there's something going on here, then I'd definitely go and see the GP.
In terms of just kind of like cycle smears and stuff, obviously there's been a change recently in terms of HPV.
Yes.
And I know kind of like talking to colleagues and kind of like friends, they're kind of like, oh, what does HPV mean? What does HPV positive, negative? When do I have to worry, and what do I have to kind of like think about?
So the HPV virus we found is responsible for most cervical cancers, and actually for some of the vulval cancers as well. Okay. So it's 99% of the cervical cancers is caused by this HPV virus. Now we often all have HPV and our bodies can fight it off, and there's many different variations of it. In fact, they've obviously started doing the vaccinations now as well, so that will cut down on it. So what they do now, because most cervical cancers are caused by the HPV virus, when they do smears, they look to see if that virus is present, and if it's not, then they don't look at the actual cytology of the cells and things, because we know that if that HPV virus isn't there, then the cancer's not going to be there. If the HPV virus is there, then they look at the cells in great detail and things and see if there's any changes to the cell. The majority of the cases not, but sometimes you do get some changes. And even with that, it's actually a bit of a process going on. So the gap in between smears, and again they've lengthened that. It used to be 3 years and now it's 5 years. You're gonna find, you know, if you're HPV and you've got had an abnormal smear, they'll get you into the system and we look at it a bit more. But in between those two, you're not going to go from nothing to full-blown cancer and advanced in those 5 years.
Yeah.
Yeah.
So if you've got HPV negative at one smear, you could then be HPV positive 5 years later.
Yeah, because you can have it, and sometimes it'll just disappear because your body's fought it off itself. You know, so it's not the end of the world if you've suddenly had it and thought, how did I get that? It's, you know, you might have just had it in your body, it was dormant, and it's flew up again. Yeah.
Okay, that's great. Well, it's been really, really informative. Thank you so much. I think we've taken away, everybody needs to keep a track of their cycles and any irregular bleeding and things like that. They need to do their pelvic floor muscle exercises. And if you're suffering with anything, then please do seek medical attention. And like the girls have said, if you're struggling with particular issues and you feel like your GP can't help you, then ask to speak to a different GP, because sometimes they have had different training and things, and there's a lot of,
and all the websites you're going to put and the links and things. So there's lots of places to get information, and you know, sometimes it's just reassurance you need. So there's and just know your own body, and don't be afraid to examine yourself and know it, isn't it? Yeah.
It's about knowing our own bodies, knowing what's different.
Yeah.
If you know what's normal, then if something is, then you can act on that a lot easier.
That's great. Thank you very much. So we'll put all the links on this post as well. But thank you very much, everybody, and happy International Women's Day.
Yeah.